Hi, so thank you so much for the opportunity to speak to you all today. My name is Heather Gilmartin, and I am a nurse practitioner and trained health services researcher who will be working with you all around the relational facilitation aspect of our implementation work. So, some background. Evidence-based practices are essential to achieving the quadruple aim of healthcare, which is enhancing the patient experience, improving population health, reducing costs, and improving the work life of healthcare providers, be they clinicians or staff. Translation of evidence-based practices to the real world is slow and influenced by poor communication and relationships, limited awareness, inadequate incentives, and absence of leadership support. Targeted and human-centered implementation strategies can enhance translation of of research into practice and support the quadruple aim. So let's break this down. What is facilitation? It is a process of working with groups to support collaborative work. Said another way, it is a method by which one person makes things easier for others. Facilitation has been shown to support implementation of evidence-based practices. So what is relational coordination? Relational coordination is a theory that focuses on how the connections between roles impact organizational performance. The focus is on communication and relationships for the purpose of task integration or getting work done. All of you in your work and personal lives have experienced relational coordination. When you try to organize a patient discharge or a work project or a school or family activity, you are connecting with others to coordinate this work. Dr. Jody Gattell from Brandeis University developed the relational coordination theory, and she identified 7 behaviors that are critical to high-performing teams and high-quality work. These include 3 relationship behaviors: shared goals, shared knowledge, and mutual respect. And 4 communication behaviors: frequent, timely, accurate, and problem-solving communication. These are proposed to behave as a single construct, which she named relational coordination. The theory has guided many process improvement projects in a broad range of industries, such as healthcare, aviation, and education across the world. So what then is relational facilitation? We have defined it as the intentional use of relational coordination as a framework for facilitating teams to implement evidence-based practices across clinical conditions and settings. So it's a new concept, and we are developing it just for the Quadruple Aim query, so just for you all. And we have designed relational facilitation as a 4-step process. The first step is to work with groups to identify who they need to communicate and relate to around a work process, such as care coordination for high-risk veterans. We then create a relational map. So the process is like process mapping, except instead of identifying the steps in a process, you identify the roles in a process and the strength of relationships and communication between those roles. So if we were all together, we would gather around a table with colored markers and a paper, ideally all those who are involved in a work process. So physician staff, nursing staff, care coordinators, social workers, nutritionists, billing department, you name it, people who work closely together to help care coordination of high-risk veterans. In a virtual environment, we will be doing this differently, and that will be explained to you as we move forward. However, what is done is that we list out all the roles that depend on each other to accomplish a work process. As you can see in this picture, we then use green pens to indicate where relationships and communication is strong between the roles, which are in the bubbles. Yellow for okay strength and red for poor. So this is just the people around the table, their opinion about relationships and communication between the varied roles. And this gives us a picture of the roles involved and the current state of relational coordination. Once the maps are created, you guys will get to work. You will launch your program and start identifying the people in each role who you work with to support your program. The second step happens a month or 2 after you've launched your program. We'll ask for the names and email addresses of people who work in the roles identified on the map. So Ideally, you have at least one person in every role, but you might have 2 to 3 people in each role who you connect with routinely. Then we will invite you and them to complete the relational coordination survey. And this is a 7-item instrument that assesses the state of relational coordination in your program. And you'll be asked to answer the 7 questions listed here on the slide for each role you work with. So, for example, how frequently do nurses communicate with you about care coordination for high-risk veterans? Do they communicate with you in a timely way? Do they communicate with you accurately? And that will go on for all the different roles that you have identified as part of your group. And this is like a 360-degree review. You indicate how frequent, timely, accurate, and problem-solving your communication is with inpatient nurses. And then people in those roles indicate the same about you. You also indicate how much people in the group, again, inpatient nurses, share goals, share knowledge, and have respect for the work you do. You're not talking about a particular person, i.e. Sarah, who I work with pretty often. You're talking about Sarah and everyone who I have spoken to about this program and who backs them up, because there probably is more than one person in each role that you work with. So we will compile the data into reports to help us see areas that are strong and areas that could use some relational interventions. And here is an example of a graph that we would create for you. With this group, they were pretty strong with frequent and problem-solving communication and mutual respect. The other areas have some room for improvement. This is where we would target some relational interventions. So there are lots of relational interventions we can consider. Ones that enhance shared goals, shared knowledge, and mutual respect include job shadowing. So others can learn what you do and what you know, and then you also shadow them to see what they know and what they do. Social events, meetings, or opportunities to tell your side of the work is another option. But there's a big list, and this would be something that yourself, knowing your program and your site better than anyone else, and us as part of the implementation team would help identify. Interventions that address the communication side of relational coordination include things like huddles, creation of newsletters to share information, or giving protected time for teams to meet and problem solve. Again, yourselves and us in the implementation core will help you figure out which ones might be a good fit, how to implement it within your team, and other steps. We will check in with you periodically to see if your chosen intervention is helping improve relationships and communication. And if not, we can adapt or we can try something else. At the end of the program, we'll administer the relational coordination survey again to see if the relational interventions made an impact. We think they will, but we'll know more as we go along. In summary, the relational facilitation cycle moves from identifying the roles who support a work process by building a relational map. Then we survey individuals within each role to identify the strength of relational coordination between these roles, so a larger sample than just what we were doing with the mapping. Then we will analyze the data and discuss interventions to address areas that need improvement. We'll check in to see if the interventions are working or need to be adapted. Then we resurvey at the end of the project to see if relational coordination changed over time. So I look forward to working with you. Please reach out to your project leads with any questions. Thank you so much.